Hi, everybody, and welcome back to our next episode of the Medical Minute, sponsored by Kroger Health. Today, I have with me Lana Uhrig, and she is the newest addition to the CCA family. New and exciting things are going on here with Cincinnati Cancer Advisors, and we are growing. And we have branched out, and we now have a new location that opened last year in Naples. In case some of our viewers don't know, we have a pretty large Cincinnati population that winters down in Naples. Obviously, cancer is prevalent across all of the United States. There's no one city that isn't touched by it. So we thought that offering our services there in Naples would be a good next step. Lana, welcome to the show. This is your first episode. So welcome. And can you just tell me a little bit about our Naples location and our mission and what you're doing down there?
Great. Yes, thank you. So we went down to Naples last January and got the office started in April of 2023. So we've been up and running now for a few months, starting to see more and more patients, just getting the word out. And we're located at 3201 Tamiami Trail North. That's on 41 for those of you who are familiar with the Naples area. And we're in Suite 112, that's the Naples Professional Suites. And so just similar to the Cincinnati Cancer Advisors office, we are really working to help patients who have a cancer diagnosis, who are seeking a second opinion, to walk out feeling very comfortable with the plan of care that they have so that they understand what's going on. We help them put the pieces together. It's very confusing when you've had a cancer diagnosis, as you know, and oftentimes patients have seen multiple doctors and they have information in multiple portals and they have records everywhere. And so it's just really disconcerting sometimes to be a layperson trying to put all of that medical knowledge together. And so what we do is help them weave all of that together and put their whole story together. And so they walk out feeling like they have their journey mapped out and they know and feel confident that they're on the right track.
Now, is this open to any cancer diagnosis?
It is, yes. We see all cancer diagnosis, adults. We don't see as many children, but we are open to that. But we mostly focus on adults. And to be referred, it can be a self-referral. You can come through your physician. We get a lot of self-referrals. We get a lot of patients that come through their physicians. So it really is open. We can be reached through our phone number, which is at 239-846-CARE. Or on our website at naplescanceradvisors.org. We have a self-referral form there as well.
Now, are there any additional services that the Naples Cancer Advisors offers to cancer patients other than just the second opinion?
Yes, absolutely. That's one of the things that we offer, I think, that makes us very unique. Beyond just a second opinion, we really help patients with care coordination. We help with clinical trial navigation. We help with financial navigation. We have a precision oncology program where we help patients with genetic testing and counseling and really being able to decipher all of those really confusing things that come with that testing. We consult with their physicians. Everything's very transparent and upfront. So when a patient comes, we never want a patient to feel triangulated from their physician. This is all about helping their journey go more smoothly and taking the stress and anxiety off of them. So our physicians and our nurse practitioners communicate with their physicians, and we prepare a very detailed plan that we send with the patient and send to their physicians so that everyone's in the loop. And so then we feel like that gives the patient the most connected and coordinated care. So we really offer a very full service package. Although I will say, and I wanted to make sure we point this out, we don't treat. We're not treating oncology practice. We only do consultative care. So we never seek to take over a patient's oncology care. We are just consultative in that sense.
And that's nice, because what we've essentially done is taken the mission from Cincinnati and transplanted it in Naples to make it accessible to the Naples community.
Exactly.
And it's also reassuring for the local Naples physicians, because we're not assuming the care of these patients. We're reviewing things, making our recommendations, and then essentially collaborating with the treating oncologist.
Exactly. And it also, one of the things I have observed in being in Naples for the past few months is that it's a smaller community. They don't have a comprehensive cancer center in the greater Southwest Florida area with Naples and Fort Myers, Marco Island, Estero. So oftentimes people feel, should I stay local for my care? And they're not sure. But if you don't need to travel, people don't want to travel when they're sick and they don't feel good. And so oftentimes you just need reassurance that the plan of care that you've been prescribed, that your doctor is recommending, is it the right plan of care? And sometimes reassurance is all you need. However, sometimes there might be other options or opportunities that complement that. And I think that's where we can really be helpful to give either that sense of reassurance, or we can add complementary options for patients that they maybe hadn't considered, and consultative suggestions.
We lovingly refer to it as filling in the gaps.
Exactly.
So I'm going to turn things a little bit and just kind of highlight one of our physicians, our medical director, Dr. Philip Lemming. He has a entire career specializing in skin malignancies, melanoma being his most prevalent. And as beautiful as Naples is, one of the reasons that so many people flock there is because of the beautiful weather and the sunniness, and with that comes a lot of exposure to the sun and the damage that it can do to the skin. So, I've definitely, been in the community, talked to some of the clinicians, know that, there's lots of dermatologists throughout the entire Naples area to, be there for those skin checks. But if a patient does have a melanoma diagnosis, and they need additional education, they want, again, like you were talking about, need additional reassurance that their plan of care is the right plan, or need to know what their next steps should be. Naples Cancer Advisors is a great opportunity for that, with someone that has a lot of bandwidth of that specialty and understanding. We obviously also have Dr. Jazzy, who is our lung cancer and GI specialist. And then Dr. Zahn, who she actually will be down in the community at some time in May. She is the incoming ASCO president and our breast cancer specialist. So you've had the opportunity to work alongside these physicians and kind of bridge the communication between the physicians and the patient. And do you feel like it's been well received by the Naples patients that have been seen?
Absolutely. It's just been, to me, having been in healthcare and in the oncology space for many years, just such a refreshing experience to work with this team and work in this environment where we get to offer a service where we're not worried about billing, we're not worried about trying to collect or get insurance cards, because we do everything we do free of charge at no cost to the patient, all because people are generously donating to what we do. And so because of that, I get the privilege to be in these consults and see these patients who have the opportunity to talk to our physicians who put this whole picture, and our nurse practitioners too, who put this whole picture together. And I, have to say, I've listened to you, Jill, talk to patients about their chemotherapy and their immuno-oncology, immunotherapy, and, tell them all of the things that they need to be aware of and thinking about, and toxicities to be aware of, and just that education that is so far beyond what they get anywhere else. And they just go out so much more prepared and ready. I think the right word is empowered. That's what I see more than anything, is patients go out feeling empowered. They are then, I think, able to become their own best advocates for their care.
And doing all of that without adding to the financial toxicity of cancer care, because we all know how expensive that can get.
Exactly.
Well, welcome to the family.
Thank you.
And thank you all for tuning in and getting our update on our latest addition to the CCA family. Stay tuned for our next episode, and we will see you next time.